Hi everyone. Today I'm going to demonstrate proper decontamination of surgical instruments using a safe stimulated exercise. For this demonstration, I am wearing my full personal protective equipment. I have gloves to protect my hands from contaminants and cleaning solutions. I also have my surgical mask to prevent any inhalations or any splashes. I also have my eyewear for eye safety, a gown to protect my skin and clothing. So first, I'm going to be cleaning the instruments today. I'm going to be cleaning a Lorna non-penetrating towel clamp, a Met scissor, CVD Ferris Smith forceps, and Yanker suction tip. For the stimulation purposes, I have contaminated them with mustard. This is the guts. I also have hot sauce, which is blood. I also have Nutella, which is for the poop. And then I also have oatmeal on this one to display as throw up. These substances mimic organic debris and are especially effective in demonstrating cleaning. So now I'm going to go into the cleaning. 1 second. Okay, so before cleaning, as you can see, I'm all ducked up in my full PPE gear. So before cleaning the instruments, I am going to fill the sink with my detergent. With warm water. Your water should be in between 80 to 110 Fahrenheit. So I have the mild detergent and the enzymatic cleaning solution, which I'm going to pour into the sink. Let's get that. This is the water. Oh, I'm sorry. I also have my sink 1, sink 2, and sink 3. So now what I'm going to do is the first tool that I'm going to be starting off with will be the Yanker suction tip. I also wanted to add that enzyme-based detergents are specifically formulated to break down blood, tissue, and other organic matters. Warm water helps loosen up dry debris, while detergents help dissolve organic matter. So first what we're going to do, sorry, I'm just pulling up my notes. One second. Okay, first I'm going to be cleaning the Lorna non-penetrating cow clamp, which is saturated in blood. First thing first, I'm going to make sure my water is the right temperature. I'm going to take the instrument and I am going to I'm going to have the instrument. I'm going to take my scrub brush and I am going to scrub the lockbox. Make sure everything's fully submerged underwater. These clamps have delicate serrations, so I scrub gently but thoroughly. According to the IFU, using a soft bristled brush prevents damage while ensuring all contaminations are removed. Cleaning underwater. Okay. As you can see, I am scrubbing thoroughly to make sure no residue is left behind after surgery. Make sure there's no visible blood stains. And remember that the clamps have delicate serrations, so you want to jab gently, but you want to make sure it's clean. Okay. So as you can see, instruments are all clean. Next, I'm going to put them in a second sink, which is the rinsing. So this contains utility critical water. After cleaning, devices should be thoroughly rinsed to further assist in removing debris. So I'm going to take my second rinse. I'm going to thoroughly saturate this in the water, make sure everything is clean. I'm going to rub and make sure it's clean. The third sink is the final rinse. This contains critical water. This helps prevent instruments from spotting. So I'm going to take this. I'm going to place it into my second rinse. I'm going to rinse that off. Rinsing that off. And then I'm going to set it on this towel to dry. Okay. Next. The next item that I will be cleaning is my Met scissors, which is contaminated in poop after the surgery. So with this, they require special attention to the blades and the pivot area. I am going to be scrubbing along the blades in one direction to avoid, sorry, I have to go in the water, to avoid any building to the floor. Scrub this underwater. Make sure all the areas are clean. We're gonna close that. Scrub the area. Make sure that's all clean. And then we are going to do the second rinse. We're going to do the third rinse. And then we're going to take this to dry. Okay, so next we are going to be cleaning the Ferris Nest tissue forceps. With these, they are strong. They have really strong interlocking teeth. They are due for designing and grafting tissue. So I'm using a small brush, which is this, to clean every tip and serration thoroughly. So as I am cleaning this, notice I am paying close attention to the back flap and the hands area. Following IFU recommendations, I avoid excess smoke soaking to prevent corrosion, but I make sure every bit of stimulated organic material is removed. So I'm just going to continue to brush along here. We don't want to saturate it in the water. I'm going to wash this off, put that to the side, and I'm going to get my sponge. I'm going to continue to rub till this is fully clean, okay? Don't forget that we are not soaking. We are not soaking to prevent corrosion, guys. Okay, now that's done. Second, third, off to drying.